Everyone is filtering their skin.
Have any new surgical trends emerged during this year of pandemic?
Yeah, I mean, this pandemic has created a lot of pent-up demand, and people are having procedures that normally are new procedures that are introduced. But right now, there's string lift procedures. There's devices put on the inside of skin to try to tighten skin from the inside. And I'm seeing a ton of complications related to that. My take-home message for that is, if it's a new procedure, maybe you don't want to be the first group that has it done to you.
I'll add a different spin on that. One thing that we're seeing in practice is, because everyone is Zooming all the time and at home, a few things are happening. Number one, tech neck, when they're going like this and seeing extra skin. So we're seeing more neck and face lifts. Two, we're seeing a lot more eyelid surgery. And again, people think that we just do revision surgery sometimes. We do all aging face work also. That's number one. So we do first time surgery. In addition, everyone is filtering their skin, which is good in a way because that means they're coming into our spas and doing Botox and fillers and taking care of their skin, hydrofacials, and of course, with our skincare lines, they're doing very well.
What are you most excited for fans to see this season?
This season is very different because we're doing the usual, of course, very difficult noses, breasts, tummies, and buttocks, but a lot of different body parts, a lot of complications associated with surgery done to fix functional problems. Very, very different, very unusual.
I mean, more a little bit, remember Botched by Nature, which we had one season where we were taking patients that had congenital deformities especially, and then maybe had surgery. I mean, we have a patient that has a gigantic piece of tissue wound. It looks like she got bit by a bull shark. We have a young lady who was born with this gigantic mass on her neck. She calls it the beast. We have a guy, sorry, with a deformed nose. And the interesting thing here is he thinks, possibly so, that an IUD inside of his mom's womb caused that. And so we have all kinds of crazy stuff this year. It's very emotional between all of us. We go through a lot of complications and how to work through them. And, you know, and the usual comic relief, you know, with Harry making fun of me, especially on the first episode. First episode especially.
Yeah, you got to have some comedic relief in there. I know, like you said, you know, this season not only deals with botched surgeries, but some traumatic events that these people have gone through. How difficult is that for you when kind of, you know, you put a whole new layer to this on these surgeries as well? Or is it even more rewarding because you're kind of changing these people's lives?
I think the stakes are higher when they've been living with a complication or deformity for a longer period of time. Initially, it looks like they've sort of learned how to deal with it, but right below the surface, it's much more deep-seated. And it's something they had to go through childhood sometimes and early adulthood, and it can be very, very disabling. I mean, the guy with a shark bite missing half of his abdomen, it's gone. He's 23, handsome, he wants to have normal social engagements and involvements. How do you do that with this giant missing piece to your body?
Or the young lady who's on the first episode with her nose.
Yeah.
She looks like she has a piece of sharp metal inside of her nose about to pop out of the skin. And she's walking around with that nose. And so these are things that, you know, but you asked a very specific question. Well, is it rewarding? Obviously, it's high stakes, as he mentioned, and high risk, and we have complications. But if you can take someone and increase in the improvement on whatever that deformity is, you are automatically improving their lifestyle, how they feel about themselves and their confidence. And obviously, that's really rewarding.